with the caller, going through their specific symptoms and talking about simple things that they can start trying at home right away, and then making a plan based on what it sounds like the problem might be with them, so that they are not DIYing their own sleep health, by trying to find solutions online. We can guide them, and it's free, and they get a fairly personalized action plan.
What's that number?
It's 09391 0009.
09391 0009. Auckland Sleep Director Sumit Cement, kia ora to you. Thank you very much for your information.
It's been a pleasure. Thank you.
Right, time for I've Been Thinking. Rawani Pereira, you first.
Okay, well, we've just had our Labour weekend, obviously, where we celebrate our, 40-hour working week, which is all blurred now as well in the last 10 weeks if you're in Auckland.
Isn't it?
But also in the UK, they're having a rise in their minimum wage. And it's just another timely reminder. I mean, when you look at the places of interest in any of these COVID outbreaks, it always involves pretty much a supermarket. I really want to shout out to all those supermarket workers, and $22 an hour minimum wage is not enough for the work you do. I tend to go every other day to the supermarket. It's part of my social sort of socialising, and you see the same people, they're hard workers. It must be frightening for them to go in every day. And you think of all the money that our duopoly supermarkets are earning right now. And I just think, they had a rise last lockdown, and they're so due another one right now. And when you think of inflation going up and you think, the cost of labour increase, it's only a tenth of inflation that is from wage increases. It's nothing for us, and we need to do better for those essential workers.
Right, a call to lift the national minimum wage. That is Rawani Pereira's view on I've Been Thinking. Peter Dunn, I've Been Thinking.
Well, I've been thinking about the COP26 conferences coming up in Glasgow next week. We know this is one of the biggest events the world will have seen in terms of getting commitments from nations about what they're going to do to reduce global warming and etc. But I'm not so convinced that at the individual level, we as citizens know enough about what the implications for each one of us and our lifestyle is going to be moving forward. Governments around the world have been very good about talking over global commitments. I think the picture about national commitments and implications is a little more vague. And what worries me is that ultimately these things rely on getting political consensus and the support of regulations to put them into effect. And if people don't have the information to feel comfortable with the choices they're being asked to make, then I'm a little bit concerned that all the good work that might be done by the negotiators and all the policy stances that might be developed
what more
could be undermined.
Peter, what more information do we need? There have been any number of articles.
There's a lot. Yeah, but there's a lot of articles. There's been stuff put out by the Climate Change Commission. There's a lot of stuff out there, but it's all at such a level. I don't think the average household can sit down with sufficient confidence yet and say, this is what it's going to mean for us. And I'm talking about information at that very basic level. What's it going to mean for things like power prices? What's it going to mean for, we talk about electric vehicles, fine, but what's that going to mean in terms of the household budget? All of those sorts of things. And my fear is when the crunch comes, all the worthy sentiments give way to someone saying, to hell with that, I'm not going along with that, and I'll cast my vote accordingly at the ballot box.
All right, that's very interesting. Peter Dunn, thank you for that. Someone says, when did I realise I was not young anymore? I found out I was no longer young when I was a university student who was helping us with the garden, told me that she loved our vintage car. The vintage car was a Ford Laser. Emily from Waikouiti, thank you very much for that. Peter Dunn and Rawani Pereira with us on the panel, 4 to 5, right here.
RNZ News at 4 o'clock. Kia ora, good afternoon. I'm Sarah Bradley. The government will shortly hold another post-cabinet press conference. We'll be crossing live to the announcement as soon as it begins. in the meantime. Auckland public health officials continue to urge residents of the North Shore suburbs of Redvale and Rosedale to get tested as soon as possible, even if they have just mild symptoms of COVID-19. There have been high rates of positive tests amongst swabs taken in the areas, with more than 6% in Redvale and 3.8% in Rosedale. Testing will help to provide assurance that any undetected spread in the communities is identified as quickly as possible. New Lynn and Bayswater are no longer specific areas of concern, but residents are urged to be vigilant for symptoms and get tested no matter how mild. There were 79 new community cases reported today, 75 in Auckland. 4 new community cases of COVID-19 have been reported today in the Waikato DHB area, all linked to existing cases. There are now 52 active cases in Waikato and King Country. 35 are in Te Awamutu Kihikihi, which includes today's 4 new cases. 25 in Hamilton, 23 in Raglan, 3 in Cambridge Karapiro, 2 Otorohanga, 2 in Whatawhata and 1 at Kawhia. The total number of cases since the outbreak began is 91, with 6 still not epidemiologically linked. 84% of the eligible population have had 1 dose of the vaccine and 66.9% are fully vaccinated. An Auckland high school principal says some of his senior students are taking a wait-and-see approach to returning to class. It's the first day in months that year 11 to 13 students in Auckland and much of Waikato can attend lessons in person. The principal of James Cook High School in Manurewa, Grant McMillan, says about a third of the seniors turned up today. He says they've told teachers they feel safe and are happy to be back. Mr McMillan says the school is working on a range of options for students who haven't returned. A leading epidemiologist says banning unvaccinated people from taking flights will help stem the spread of coronavirus. Otago University's Michael Baker says allowing unvaccinated people on a plane increases the risk of infection. Professor Baker says the ban needs to happen on domestic flights now to protect travellers. He says it's recognised groups of people shouldn't congregate indoors unless they're vaccinated. A Thames Coromandel District Councillor says he doesn't want to go to council meetings with an unvaccinated mayor. The mayor, Sandra Gowdy, and her entire council this morning supported a motion endorsing the vaccine rollout. But the mayor isn't getting Pfizer immunisations herself, instead stating a preference for the Novavax shots. Councillor Gary Gottlieb is stuck in lockdown in Auckland, but he's hesitant about going back to council meetings. Gary Gottlieb says Sandra Gowdy should resign. More than 20 small rural communities in Southland will be visited by vaccinators during a week-long Farmgate tour next week. The plan was hatched by Gore District Mayor Tracy Hicks and Southland District Mayor Gary Tong to raise vaccination rates in the region. The mayors will tow caravans with staff from Southern Health to vaccinate the communities. They will return at the end of the month to ensure people get their second doses. An Auckland woman who is sailing more than 2,000 nautical miles across the Pacific after failing to get an MIQ space is expecting a bumpy but worthwhile voyage. Normally a chief steward on super yachts, Katrina Hughes joined the 40-foot SV Kingfisher in Tahiti from the United States. Ms Hughes says the skipper bought the yacht in Tahiti and registered it in New Zealand to meet maritime border requirements. All 4 crew tested negative for COVID before leaving Papeete on Friday, and the 16-day voyage will meet quarantine requirements as long as they test negative on arrival in Opua. Australia has joined other nations in vowing to go carbon neutral by 2050, ahead of the Global Climate Change Summit next week. About $20 billion will be invested in climate-friendly technologies by 2030. The Prime Minister, Scott Morrison, says it's time for action. The latest projections show Australia is on track to cut emissions by 30 to 35% by 2030. That's the news. We will be crossing to the Beehive as soon as the Prime Minister arrives. But right now, here's the short forecast from Met Service to midnight tomorrow. For western areas from Northland to Wellington, mainly fine today, with just a few showers about the hills, scattered rain at times tomorrow.
Kia ora koutou katoa, good afternoon. First, the week ahead. Tomorrow I am in Wellington, where I'll have a farewell call with outgoing Children's Commissioner Judge Andrew Beecroft. Overnight on Wednesday, I'll be attending the East Asia Summit Leaders Meeting, which is happening virtually this year. And on Thursday, I will be in the Wellington region attending events to support our ongoing vaccination drive. Today, I'm joined by Workplace Relations and Safety Minister Michael Wood to set out work we are doing as a government to help support employers as they consider the role of vaccines in their workplace. Last week, I set out our new COVID-19 protection framework that will move New Zealand forward once each DHB in New Zealand has reached 90% of their population fully vaccinated. The more people who are vaccinated, the safer we all are. That gives us options and the ability to keep people safe without having to use some of the more blanket restrictions that we've used in the past. That's because if you're vaccinated, you are less likely to get COVID-19, and if you do, you are less likely to get really sick. In fact, in our current outbreak, only 5.2% of cases have been fully vaccinated. We know then what this means for Auckland. There are now just 11,000 first doses shy of hitting 90% vaccination rates across all DHBs for the eligible population. Once those first doses then go on to receive their second dose, Auckland will move into the new framework, meaning businesses can open and operate safely again. The same transition will apply for the rest of the country once the remaining DHBs also hit 90%. But what if we have cases in the meantime outside of Auckland and before we are ready to move into the new framework? You can already see what our response in these cases would be. But the short version is that if you don't know where a case has come from, and if there might be other cases that we don't know about, we are very likely to continue to use the level 3 restrictions we have now. None of us want that, especially as we move closer to summer and Christmas. So the answer is simple: vaccination. We don't just want Auckland moving into the COVID protection framework as soon as possible, we want everyone to. It's the best way to give certainty to business and to our communities, and that we are doing all we can to ensure we reach those targets so that we can minimise the disruption of COVID. But of course, to do that, we need to ensure those vaccination rates lift. So please, don't wait until cases come to your town or your city. Get vaccinated now. In the meantime, there are other ways that we continue to support businesses as we prepare to implement the new framework. The government has already mandated vaccination across workforces in important sectors where workers are likely to come into contact with COVID-19, including the border, health settings, and of course, education. With the new traffic light system, businesses that we previously treated as high risk, like hospitality, hairdressers and gyms, can operate at all levels if they ask customers for a vaccine certificate. And so it follows that if customers must be vaccinated, then so too must the workers. We want workplaces open, customers safe, and workers safe too. In recent weeks, the government has been engaging with Business New Zealand and the Council of Trade Unions on this issue, and the clear message we have heard is that businesses, large and small, want a clear legal framework on the issue of vaccines and vaccine mandates. They want certainty and simplicity, and we're answering that call. Cabinet has decided today that vaccinations will be mandated for everyone who works in any workplace where a vaccine certificate is required for entry. In the new COVID-19 protection framework, this includes hospitality, events, gyms, and close proximity businesses such as hairdressers and barbers. The timing of this coming into force will depend on when we move to the COVID-19 protection framework. We'll continue to work through the detail with businesses and unions to ensure we get the balance right, and Minister Wood will have more to say on that shortly. This requirement means staff and customers are treated equally, and it will play a big part in helping to minimise the spread of the virus in the highest risk venues by reducing the potential for COVID to enter the business in the first place, and further supports our businesses in their economic recovery. But beyond those workplaces, employers are also asking us for more guidance and more certainty. So I'll now hand over to Minister Wood to lay out more details of today's decision. Minister Wood.
Thank you, Prime Minister. As we all know, getting vaccinated is the most important thing that we can do help stop the spread of COVID-19 and to keep our whānau and workplaces safe. Right now, I'm here in Auckland with 1.7 million other Kiwis, and we desperately want to get back to the things that we love. Having rates of vaccination of 90% plus and confidence about the places that we can go under the COVID protection framework is critical to making that possible. That's why, as the Prime Minister has confirmed, Cabinet has agreed today that we will require vaccination for all workers at businesses where customers need to show COVID-19 vaccination certificates, including hospitality, events, close contact businesses and gyms. It isn't just employers that have been asking us for clarity on this. We've also had workers asking how they can have assurance that they're safe from COVID while at work, and by mandating vaccinations for both customers and employees, we hope to give them that peace of mind and help to protect public health. As the Prime Minister has said, the timing of this coming into force will depend on when we move to the COVID-19 protection framework. We're working closely with the CTU and Business New Zealand to make sure that we will have robust guidance for businesses ready well in advance. And I would just like to acknowledge both Business New Zealand and the CTU, who have been working closely with us as we work through these complex issues in recent weeks. For now, I encourage workers in these industries who are not yet vaccinated to please get your first vaccination. Some businesses have already done a risk assessment to require some or all of their workers to be vaccinated. But businesses and unions are asking for more certainty and clarity, and employers sometimes are concerned that their decisions might be legally challenged. We intend to change the law to introduce a clear and simplified risk assessment process for employers to follow when deciding whether they can require vaccination for different types of work. It'll cover simple factors like who workers interact with during their work days and how close that contact is. We intend to make it very clear and simple for employers to apply. This risk assessment is based on the guidance provided by WorkSafe, with input from public health officials, business representatives and unions. Just like with health and safety assessments, employers will have to consult workers and their representatives when using this risk assessment process. This process won't override risk assessments that businesses have already done under the existing health and safety guidelines. It'll be about how we move forward. Employers will continue to be able to exempt any workers from a vaccination requirement they introduce. We will suggest that people who cannot be vaccinated for medical reasons should be exempt, noting that that is a very small number of New Zealanders, unless their work is so high risk that this is not safe. Some overseas markets may prevent access due to COVID-19 related issues in export food production premises. Such barriers have the potential to affect our trade, which is vital for our economic recovery. To help protect our economic recovery, we have therefore also agreed to allow vaccination to be required if it is necessary to facilitate access for New Zealand products to specific overseas markets. More information about this will be available from the Ministry for Primary Industries in the coming weeks. We do know that these changes will raise questions around what happens when mandated employees do refuse to get vaccinated. To provide clarity, a new 4-week notice period will apply if people are terminated if and when they choose not to be vaccinated and their work requires it. We're expecting many more employers to require vaccination for work in their businesses. This law change will require a minimum of 4 weeks paid notice for any employee who loses their job because they are not vaccinated. Most employees will have notice periods in their employment agreement already, but this will create a basic minimum. The change will only apply to employees who do not have a notice period, or if that period is shorter than 4 weeks. This will effectively be the start of a countdown. Once the notice period commences, the employee will have that amount of time to get vaccinated. Provided it is reasonable to do so, the employee will be able to retain their employment if they get vaccinated in that period, but their employment will be terminated if they do not. Other aspects of employment law will not change, and employers and employees will continue to both need to behave in good faith. We know that some workers can find it difficult to find the time that they need to get vaccinated, as they might have childcare duties, shift work, or other complications. To make sure that there are as many opportunities as possible for workers to get vaccinated, We're also going to require employers to provide paid time off for workers to get vaccinated. We know that most employers have already been doing this and are taking steps to support the employees, for example, by providing transportation to vaccination centres. This change will ensure that all employees can get vaccinated during work hours, removing a potential barrier and helping employers to raise vaccination coverage in their workplaces. Employers will also be required to keep records about employees' vaccination status. MB will work this issue through with the Office of the Privacy Commissioner in the coming weeks to provide practical guidance on how to make sure that workers' records are handled appropriately. We know that there are questions around enforcement as well, so we're also providing more funding for WorkSafe to undertake its COVID-19 compliance role. Cabinet today agreed to provide funding of $4.4 million for WorkSafe to enable them to extend their current COVID-19 activity to undertake more proactive work using a mix of education, engagement and enforcement where necessary. We understand the urgency of moving forward and will be introducing legislation to bring these changes forward in the very near future. We will pass the legislation as a priority to give workplaces and workers the certainty they need, because vaccination is one of the best tools to reduce the risk of COVID-19 transmission in workplaces and in our communities. Thank you, and I'll pass back to you, Prime Minister now.
Thank you, Minister Wood. I might now ask Dr. Bloomfield to join us, just aware that usual practice has Dr. Bloomfield available for questions after the 1 p.m. release as well. Mikey, and then I'll come across to you.
Prime Minister, mandatory vaccines started with the education and health workforce. Now we're talking about hairdressers and barbers. Is this a government overreach?
Absolutely not. You can see we're being very careful here to make an assessment of those areas that throughout this outbreak and throughout COVID-19 have always been assessed as high risk. They are those places where you have a large number of people, often that you may not know, in a confined space or in close personal space, because that's the nature of the business. So it makes sense that if we're using vaccine certificates for customers, that customers will expect that the people that they're in contact with, who are the workers, will be vaccinated as well.
How much of the total workforce do you expect to face vaccine requirements?
Minister Wood, in the total, across the total workforce, once the mandates are in place, it could be upwards up to 40%. Do you wish to expand on that, Minister?
That's right. The current orders which are in place cover approximately 15% of the workforce, and our estimate is that those workplaces covered by COVID vaccine certificates are potentially around about another 25% of the workforce. So that would bring it to around about 40% in total, noting that other workplaces would still have access to the simplified risk management framework that we're providing.
Is this about punishing the people who are refusing to be vaccinated, and does it further create a two-tiered system?
Not at all. I think questions would rightly be raised if we had introduced a regime of vaccine certificates to ensure that we actually could safely open some of those businesses who have faced closures on and off throughout COVID-19. And using vaccine certificates there enables us to open confidently. But questions would rightly be asked if we required those who are customers to be vaccinated, but not the people that were serving them or working in hospitality, or those barbers, or those places where vaccine certificates were being used. So this is about creating an environment where it makes sense that you can be assured customers, but also workers are both vaccinated.
Prime Minister, if someone then ends up losing their job, are they just sort of marginalised by society? Will they still be able to access benefits? What happens then for those people?
Your ability to access government support and your ability to access, for instance, an unemployment benefit or to seek support in finding new employment is not and will not be affected by your vaccination status. In fact, unlike, as far as I can tell, many other countries, we've taken this step of both saying where vaccination certificates will be used, but also where they cannot be used. We will not use them in places like supermarkets or to access health services or critical health needs through things like pharmacies. We do not want people who are not vaccinated to be precluded by accessing the basic necessities of life, food, healthcare, and so on. I'll come to
the flip side of that. What about the flip side of that, particularly with the likes of WINS? Will you mandate for customer-facing WINS staff to be vaccinated so that
vulnerable people aren't put at more risk.
And you can see here the questions that that are being put to us, complex, difficult questions around vaccine mandates on a daily basis. And what we're looking for here is a very consistent approach. We have a duty of care to protect the most vulnerable, but at the same time, of course, making sure that where we're applying mandates, we're doing so in a reasonable way. Minister Wood, would you like to speak to what we're doing across government services generally?
Thank you, Prime Minister. That's right. In addition to the areas covered by COVID vaccine certificates for which we have confirmed a mandate today, ministers have agreed to do some further work in the coming weeks as to whether it is appropriate to include other areas within vaccine mandates. This could include some of those sorts of government services that you've identified. And obviously there's a particular nature to them whereby the clients of MSD, for example, do not have any choice but sometimes to interact with people who are working in those areas. So we'll certainly be investigating that, but we have also agreed that we won't be restricting ourselves just to public services. We will be considering whether there are other areas where it is appropriate to consider these mandates. But we want to do this in a proportionate, considered, consultative way. So as we have been in recent weeks, we'll be working carefully with Business New Zealand and CTU as our social partners and other key stakeholders as we consider that.
Two final quick points on that. Again, I cannot state more clearly how important it is for us to be known that your access to government support will not be affected by vaccination status. We're very clear on that. The other point to make is we're up to almost 90% vaccination rates in some areas. And in fact, you can see well over 80% first doses for the general population. We're now talking about, for instance, workplaces where the vast majority of employees will be vaccinated, but giving clarity to employers about what to do if they have one or two who may not be.
I may have misunderstood, but is this an opt-in system for employers? It's not a compulsory.
So where we'll be requiring the use of vaccine mandates is for those places where vaccine certificates are used. So if you're a hospitality business and you're requiring, within the traffic light system, you're requiring customers to be vaccinated, it naturally follows that your staff need to be as well. For the rest, for other employers, so retail, for instance, we don't require vaccine certificates there. They may legitimately want to use vaccine mandates. We're giving greater clarity in the law about the process they need to go through if they are to adopt a vaccine mandate for their staff.
And on that, so if areas that aren't customer facing, so office workers, are managers or owners of those companies able to apply this to that setting, even when there's no customer facing at all?
Yeah, so this is where they would undertake their own assessment based on the framework that's been established. Minister would speak to already, we've got a framework already out there, but what we're looking at is how we can simplify that and also give even greater reassurance to employers where they are making that assessment themselves. Minister Wood, would you like to speak a little bit more to some of the detail around that risk assessment?
Yes, thanks, PM. Look, it is important to note that we do already have some employers who are using the existing risk framework which is in place, including some employers who mainly have back office functions. But what we have heard consistently from employers, from unions and from others is that they would prefer a much simpler and clearer process. So we'll be doing effectively two things here. One is we will be lifting up the risk framework and putting it forward as secondary legislation. So it's currently on WorkSafe's website as guidance. People have said they want a greater sense of firmness around what they can rely upon. So we'll be working that through as a piece of secondary legislation. But secondly, as the Prime Minister says, we're working to make it as clear and as simple as possible about when it is reasonable for an employer to require vaccination as a condition of employment. And so that'll be very simple things such as the degree of interaction with customers and a small number of other criteria.
We're just very mindful that small businesses in particular want really clear and easy guidance because they're unlikely to have the HR function that many of the businesses who are already using vaccine mandates might do.
Sorry, yeah. Just clarify, hospitality businesses will still be able to choose whether they require vaccine certificates.
So at this point, so you're aware, of course, that a hospitality venue is only able to operate at red contactless if they're not using vaccine certificates, orange if they have limits and distancing, and then green, of course, it's much more open. Cabinet has made the decision today to keep this framework as simple as possible and to apply the mandate across the board for places that are eligible for vaccine certificates. But we will go out and seek some specific guidance from that sector as to whether or not they want that certainty and simplicity, or whether or not they want the option of being an unvaccinated workforce but not being able to open until you hit green. So that's something we'll work through with them.
Do you see a time when the certificates won't be necessary if vaccination hits a high enough threshold that
Yeah, potentially yes. Yeah, I'm interested, and you see that many countries who have used them for a number of months whilst they've had other public health measures in place, and then after a certain period of time have moved into a space where they're no longer using them. Of course, they've often done that through summer. What will be interesting is to see whether or not any opt back in during the winter period when there is some view that, of course, Delta and COVID will need to be more closely managed. The other benefit that those countries may find, of course, is vaccine certificates may be a way to ensure that if you are in a position where you are, for instance, implementing something like boosters in the future, if you're using a digital process, as we will be, they could be a means to ensure that people are up to date with their vaccination status. So I'll be interested to see if other countries use that tool in that way.
So
Henry, and then I'll come over to Dunier.
has the AG or his office completed a BORA analysis on these two changes, and what were the implications of it? Does this breach the Bill of Rights Act?
We've been very careful on that front. I'll have Minister Wood, who's been working closely with the Attorney General on this, speak to that.
Thank you. Well, Henry, that process would occur as legislation is developed, which is a phase that we will be moving into now. But very much we've had these issues at the centre of considerations. I've been working closely with other ministers, including the Attorney General, to be making sure that as we develop up a framework that gives certainty and make sure that we enhance public health as much as possible, that we are balancing the suite of rights issues that are at place here. And certainly as a group of ministers, it is our view that the overriding public importance and public interest of ensuring that people are highly vaccinated and that people can have confidence in the places that they enter means that it's appropriate to move forward with this.
Say it's likely that it will breach BORA though, long term. Even if you might decide as a group of ministers that you're allowed to, but that's worth it, that it is likely to breach the Bill of Rights.
I wouldn't make that assumption. Minister Wood?
No, I wouldn't. Look, that advice is given to us independently, so it's not for us to predetermine what that advice is. But of course, the way that the Bill of Rights works is that it does assess the complex way in which rights interact and assesses whether it is reasonable sometimes to make decisions that might be justifiable under the circumstances. But we'll wait for the advice to come through on that.
We've tried to also strike a very careful balance here. I think people would raise questions if we had a vaccine certificate regime where a venue had an unvaccinated workforce but a vaccinated group of people that they were hosting or serving. So we are trying to be very careful to ensure that everything we're doing has a public health basis to it and also balances up the rights of those who are both workers against also the rights of those who may be clients or customers as well.
Did Cabinet make a decision today to shorten MyQ stays for double vaccinated detainees?
You'll know that when we are ready to announce changes, either decisions made by Cabinet or Cabinet committees, that we do that at the time rather than speculating on when decisions may or may not have been made.
What about school kids?
I'll just come through, and I did say I'd come to Bernard and then Janae, and then I'll come to you, Jackson.
Prime Minister, do you expect that the vaccine certificates and also the law changes to enact the mandates will have sunset clauses? And also, will the law changes protect employers from Employment Relations Act actions, personal grievances, and also workplace health and safety actions?
Minister Wood.
Thanks, Bernard. Look, in answer to those two questions, we envisage that these changes will come under the COVID legislation that is currently in place that needs to be renewed periodically along with all of the other provisions. It would be linked to the lifespan of that piece of legislation. Secondly, we have made a very clear decision that we will not be doing anything active that takes away people's rights to test their employment rights in the courts. We think that is very important. But what we are doing by massively simplifying the framework is reducing the potential for there to be confusion and litigation, which is what's been identified to us by both employers and unions. So, for example, by creating a simplified risk framework with a smaller number of defined factors to be considered, that will significantly reduce any risks in that area. Similarly, we will provide guidance in secondary legislation about the process that needs to be followed. So while we won't be taking away anyone's employment rights to test out what's occurred in the courts, we expect that there will be considerably less risk for all involved for there to be litigation.
Just on the vaccine certificates, which are going to be crucial to make this happen, when are you expecting currently that those to be ready and in use? Because there seems to have been... November? Because there's been other reports that it will be December.
That was an error on a website, but I can tell you November.
Early November?
November. We're piloting, there will be piloting across, so testing across the system over the course of November, but keeping in mind the ability to use paper-based exists. This is the digital functions, and this will be the thing that makes it a lot easier for large-scale events and the like. So we absolutely anticipate it will be in place and ready to go before Auckland moves into the framework. I had Janae, and then I think, Jason, did you still want a question?
Oh, yes, please.
I'll go Janae first, and then Jason.
In terms of the timing, just to be clear, will this kick in as soon as Auckland or another part of the country moves to the new framework? Will that 4-week grace period start from day one when the new framework kicks in?
Oh, you mean for the employees? Do you mean the grace? Yeah. Minister Wood, so as we've said, the timing of the legislation, we're working through in some of our consultation with those interest groups. But Minister Wood, do you want to speak to how that will interact with the 4-week notice period?
Certainly. So just to step through how that will work. When the new legislation comes into effect, whether we are talking about mandates which apply to workplaces with COVID vaccine certificates, or whether we are talking about workplaces where the risk framework is applied, employers will need to go through a reasonable process with employees. They will need to consider, for example, whether it is possible to redeploy them into work that is not covered and does not need to be vaccinated. But once they have then made that decision, that is when the 4-week countdown will begin. And employees will have a final 4-week period to either get vaccinated or face the termination of their period of their employment. So that 4-week period will happen a little bit later once employers have gone through the process.
And there's no, we can't say for definite whether this is going to start taking effect as soon as we move to the new framework. Like, is there a chance that the law isn't passed before we move to the new framework?
Well, Ms Wood, there's nothing to stop a business undertaking that risk assessment now. That ability already exists.
That's right. And that's absolutely right. Officials are working as fast as they can to get the legislation in place to bring forward these changes, and I'm confident that we'll be able to line things up.
Jason.
Last week, Minister Hipkins said there'll be decisions made in Cabinet today about school kids based on year 1 to 10 and what the next step is around that. What did Cabinet decide?
I'll leave to Minister Hipkins to announce that, but what I can say is that top of mind for us has been making sure that whatever we do, it's undertaken as safely as possible, particularly when you factor in that decision-making here may affect those who are unable to be vaccinated and those primary school-aged children. But if you'll allow me to have him make those announcements or foreshadow what will happen in the future.
In the House, David Seymour was alluding to some overseas trips that you might be doing in the future. Is there any truth to his line of questioning?
I have nothing to confirm today. It is fair to say that for a number of months, of course, as we negotiate the EU FTA, we are reaching a critical juncture. And the question has been raised as to whether or not I will be able to support the conclusion of those talks. No final decisions have been made, as you can imagine. For me, so much of what I do in the next few weeks is entirely dependent on what's happening here in New Zealand. Sorry, let me just make sure I'm covering off Joe and then Luke, and then I'll come back to others.
The government has been reluctant during the course of the Delta outbreak to force vaccination, for example, with essential workers. We've seen truck drivers, for example, who've been unvaccinated, who've had the ability to travel the length of the country.
But tested.
Why is there such a drive now to mandate when you have been reluctant to up until this point?
Well, actually, what I would say is that we've been very careful and considered in where we have put in place mandates. And we've moved through each, as the risk has been identified, we've moved through those sectors, carefully considered it, worked alongside those sectors and then implemented. Border workers, you can see why. That was because the most confronting or most highest risk areas were at our borders. Then, of course, we started the consultation on our health workforce because, of course, the vulnerability of those they may be dealing with, and, of course, the fact they are more likely to interact with COVID. Then considered education because of the ability for individuals in education to be vaccinated. Now we're lining up the new COVID protection framework with the vaccine certificates, but keep in mind we've always considered the areas we're applying these to be high risk. Even before we had vaccines, we treated them in that way. And this is a tool we can use to enable those workplaces that previously would have been the subject of heavy restrictions to operate without those heavy restrictions in place. So we see it as a win-win. When it comes to those who work across borders, that's been more of an issue because of the issue we have of a hard border at the moment. So that's quite specific to our current circumstances. But we have taken that consideration. We have taken into consideration, though, the use of vaccines there. It is an area we wouldn't step into lightly because, of course, any move there with mandates could cause significant disruption to those networks, and we would do it. We would be very carefully considered and work alongside those workforces if we were to introduce mandates there.
Because I guess the counter to it is that it's a preparedness thing, and whilst Delta has been spreading and whilst there's been this urgent work to sort of contain it within Auckland, there hasn't been any sort of rush from the government to make sure people who are potentially able to spread it are vaccinated.
I disagree. I mean, actually, you will have found that there would have been times where I was very, very cautious in talking about vaccine mandates because our hope across the board has always been that we would achieve the highest rate possible without having to use mandates too widely. I think we would all want people to make the choice to be vaccinated to protect others. But there are sectors where we have seen that the majority, yes, have been, but there may be a small group who have not. And those fellow employees have wanted the confidence, as have the people that they serve, the confidence that we have covered the entire workforce.
Quickly ask Dr. Bloomfield on that because I'm sure you have another question. What has your advice been on the sort of mandating of essential workers throughout this period? I mean, have you seen the need for that considering the risk that it might have had in terms of spread?
Do you mean spread out of Auckland?
So essential workers, truck drivers and things who we've seen travel the length of country unvaccinated, take it to other places. What has your advice been over this period about whether the government should have indeed been mandated on that?
Done that though, but carry on.
So the first comment I would make, and the Prime Minister's alluded to this, is our advice was very clear from the start around testing, and hence the surveillance testing for those who are crossing the border regularly, and the requirement for effectively a pre-departure test for those who are crossing out of Auckland or coming out of Auckland on a single occasion. In terms of vaccination, our focus has been on making vaccination very easily available for those essential workers, including providing vaccination in their workplaces, and that happened from very early on, and really trying to get the vaccination rate up across those workforces. So that's been the focus there, and the focus now, of course, with these latest changes is building on the health and disability and the education workforces is to be vaccinating workers who are going to be in contact with the public and in settings where there is a high likelihood of transmission. There's a low likelihood of transmission from someone who might be driving a truck out of Auckland and then come back, especially if they are on a regular testing regime.
Prime Minister,
I know that other countries have tended to use mandates in very, very broad terms, and we're stepping through the mandates, but also giving clarity to businesses to make their own assessment as well. I did say I'd come quickly back to Luke, and then I'll come back to the Tells and then over to Ben.
Prime Minister and Mr Woods, obviously you're a Labor government. How comfortable are you with the fact that the state is mandating that employers have to sack someone if they don't get a vaccine? Workers from around the country. How does that sit with you? Can I ask you both of you?
Minister Wood?
Luke, I've spent my entire working life working for and with unions and supporting the rights of working people. So we don't move into these areas lightly or without very carefully thinking through the kinds of considerations that you've identified. But ultimately, this is about how we live together. This is about the collective rights that people and workers in our society have to be safe and to feel safe when they're at work or when they're coming into workplaces. And ultimately, we think that is the most important thing at the moment. And I would just note that we've increasingly been hearing this call from workers and from unions as well, that they want certainty and clarity, that workers want to know that when they're going into work, they're going to be safe as well. And that's why it's been really important for us that we work with both those social partners, Business New Zealand and CTU, to get this policy right, and they've engaged very, very positively with the policy that we've developed.
Yep. Dr. Bloomfield, what information do you have on some people getting vaccinated on behalf of others? Are you aware if they're getting paid to do that, for example, and what sort of penalties could be in place?
Well, there are certainly some stories circulating about this. We've not been informed about any payments that have been made for this. I guess rather than penalties, I think it's just important to point out that it's a very unsafe thing to do for someone to be receiving a medical intervention on behalf of another person, because then when both people require care from a professional, that information that might be there recorded about their vaccination status won't be correct, and that may compromise the care they receive and their health and well-being. So clearly, it's if this is happening, it's just I just strongly discourage people from doing that.
The problem is that, do you have any idea of numbers?
No, but I don't imagine it was a big problem. Whilst there's no requirement to provide photo identification when someone does get vaccinated, there are for those of you, and I expect everybody in this room has been through the process, there are multiple checks made of people's identity, date of birth, and NHI matching. So it would be difficult to get through that process, even without the requirement for photo ID, without that being picked up as something odd happening if someone was trying to do this.
Prime Minister, this is a bit of an odd one, but not odd, it's just off topic. Scott Morrison has announced that Australia has committed to being carbon neutral by 2050. Can I get your reaction to that?
Look, as we come into COP26, the calls are being made on all countries to make sure that we're doing our bit, particularly as members of the Pacific. Our Pacific neighbours have long held all of us to account to ensure that we're doing our bit. And New Zealand, I believe, absolutely on behalf and alongside our Pacific neighbours is. But it's up to each of us to be able to say that.
Just a quick, are you continuing the phase steps out of level 3 for Auckland?
Yes, so you would have heard us, you would have heard me confirm on Friday that those phase steps that we set out for Auckland, they still hold. We are still looking at the ability for Auckland to move through any of those phase steps. In fact, we designed them whilst we were designing the protection framework. So we had in mind that if Auckland were at different points, the ability to then transition into the new traffic light system.
Expect the next sort of review on that?
So we're constantly assessing against the outbreak. What we're seeing at the moment with the outbreak is, of course, we've seen growth. What we want to see, though, is really the impact of those vaccines, seeing some stabilisation in that growth. And at the moment, that's, of course, what everyone is monitoring. It's what the modellers up in Auckland are looking very closely at the moment.
Are you considering any kind of COVID testing requirement for people travelling into the South Island to better protect them from COVID?
Of course, the highest risk area at the moment for all of the country is, of course, the primary source of the outbreak in Auckland. And, of course, we do require testing for those who are regularly coming out of Auckland. So that's already happening through that movement. We haven't then applied that, for instance, in Wellington or other places where there simply isn't COVID.
Could you, because, the way that it got there was from a case that was in Tokoroa or Rotorua, so could you just require one at the ferry as well?
Yeah, we have debated this in the past. Of course, one of the reasons that we do it as a pre-departure is to ensure that we capture everyone that we need to, and in a way that makes sense as well. We did consider previously, when we were putting in that testing regime, whether or not it should happen at, for instance, a ferry terminal. Of course, despite what it says on the label, antigen testing and saliva testing is not quite as rapid as it may appear. So logistically, the easiest way to do it was before people really got too far south.
Why were some vaccination centres closed over the long weekend after the biggest drive ever from the government on Friday for people to get vaccinated?
Well, what I can say is there were still well over 100 vaccination centres open over the weekend around the Motu, and a number of specific initiatives. Most of the vaccination centres open during the week, and they were especially open on Super Saturday, are actually our general practices and pharmacies and so on, and most of them are not open over the weekend, including, of course, on public holidays. Vaccination was still widely available, and we saw some good numbers coming from different parts of the country, especially Auckland and Northland, and there were specific initiatives set up, including in Blenheim and Nelson, because of the higher interest expected there, and also in parts of the Waikato.
And just encourage, of course, you will have seen today we're making an announcement where in the future we will legislate the right of an employee to take time off to be vaccinated. I would be willing to guess that right now you'd be hard pressed to find an employer who would not give time off to an employee to be vaccinated. Please, if you're struggling to find a time that works for you or your family, simply ask, because I'm almost certain that in most parts of the country it would be welcomed by your employer.
Really quickly, Dr. Bloomfield.
I'll just let Jenna finish your question, and then I'll come back as Mark has been a mark.
Dr. Bloomfield, what can you tell us about the Waiuku case?
Waiuku case? I don't have any information on that, but happy to follow that up afterwards.
Yeah. Okay, can I come to Ben?
Just on the public panel, the panel of public health experts and modelling that you convened, Juliet Gerard convened on your behalf.
Dr. Eatown.
Yes, thank you. They declared themselves sceptics of the traffic light system, and they also wanted you to put in place a Māori vaccine target. We also have had it reported that several Māori ministers also wanted the vaccine target. Can I just ask you to be really clear about why you didn't do that? Was it because you thought that might be disharmonious, or you thought that you might not actually be able to reach 90%?
So two points I think worth making. And I'll let that group of experts speak for themselves, really, but certainly we took on the feedback of that panel. They wanted to see very high vaccination rates before we moved into the new framework. We have set that. They wanted to see good geographical spread and equity, and of course by setting a target per DHB, that's one way to achieve that as well. And they also wanted to see the ability, if required, in low vaccine pockets to use local lockdowns to be still available, and we've done that. So some of the feedback I've had is certainly that as a result of that feedback, they feel like we've picked up a number of those recommendations. On the issue of specific targets, I'll say exactly what I said previously. Consensus around the Cabinet table was reached on the way that we would try and achieve good geographic spread and equitable outcomes. And as Minister Henare has himself said, that 90% target is not the completion of our vaccination campaign. It will keep going. But we do want to accelerate Māori vaccinations. That's why we have put additional funding in to help support that.
Can I just throw a similar version of that question to you, Dr. Bloomfield, because a member of the public might be confused why there are all these experts they see in the media, Murdoch, Baker, Wiles and the rest, recommending one thing, but you either suggested that and it wasn't picked up, or you didn't suggest that. Why does your public health advice differ from those others?
Can I first suggest that you perhaps canvass a few, like Professor Skegg, who himself has, in the aftermath of it being released, spoken to it directly. So I'm not sure, the reason we went and consulted was to get feedback and then to give ourselves the ability to incorporate it. So, yep, the letter stands as a summary, but it may not reflect necessarily the view of those after it's been released and announced.
The only thing I would add to that is that the version of the framework that that group reviewed when it was convened was quite different from the final version, and the final version reflects a lot of the input that was provided there and some further advice that was sought from us about, for example, the use of CVCs, even in the green level, and the additional public health measures that should be in place right across the framework.
Specific Māori vaccine target.
We certainly put forward advice around making sure that whatever targets were determined, and I call them milestones because they're a waypoint, that there needed to be an equity component to that. And in particular, we were focused on high vaccination rates in older populations, including older Māori and older Pacific. And just to comment on that, only 22 of the 270 or so cases that have been admitted to hospital have been over 65, so 6%. And I think this reflects this very high vaccination rate we have across the board in all ethnic groups and over 65. The first group, of course, it was opened up in the wider population. So now our imperative is, and there was no dissenting voices, I think, in the public health advisors and certainly not in our team, about getting as high vaccination rates across all ethnic groups and the younger age groups as well.
Between public health experts outside government and public health experts inside government? You don't see a divergence between public health experts inside and outside government?
Well, what I would say is that right through the pandemic, there has been a range of public health voices recommending a range of things. And
well, that's where I would say just it is worth going back and checking in again. Look, I'm not expecting at all for necessarily there to broad consensus across the land from business, public health, epidemiologists to necessarily have broken out on what is an area where no country in the world has produced a hard and fast playbook. But what we've done here is different to many other countries. It combines high vaccination rates with ongoing public health protections, with measures at our border to provide progress and a way forward, but safely. And that is something that was uncharted territory. I'm going to come to Mark.
Notwithstanding the 2050 net zero target that Australia has announced, they've said that they're not going to revise their 2030 NDC despite the sort of Paris Agreement expecting that to be increased ambition every 5 years. Is that disappointing to see?
Well, look, I can only speak to New Zealand's view, which is, you know, we have an obligation under the Paris Agreement to do everything we can to follow through on our commitment around 1.5 degrees. And so that means aligning what we're doing domestically, but also our domestic commitments to the international community via the NDC. And so that's a commitment we've made, and you'll hear us updating that commitment in the lead up to COP.
Back on COVID, can either of you supply the current estimate of the R number in Auckland?
So I have Rodney's R. You probably have another R. Should we chuck both R's out and see what happens?
So Dr. Gary Jackson updates the model every day, and the R value is still in his model between 1.2 and 1.3. One of the things you would have seen over the weekend, and it's clear in the figures today, is that drop in hospitalisations. And the team walked us through that today, that a number of those hospitalisations, which went up quite sharply at the end of last week, were actually people who were in short stay assessment units but weren't actually, because administratively they're counted as admissions, but they hadn't actually been admitted to a ward. And so there was quite a spike in hospitalisations. You didn't see that increase in ICU use at the same time. So there's today only 4 people in ICU or HDU. So that hospitalisation number has come down, fits more with the pattern of the actual case numbers, and so his model today suggests that it's between 1.2 and 1.3 still, which it's been for the last couple of weeks.
Rodney's more between on the 5-day rolling average, more between 1.1 and 1.2. Yeah.
The Cabinet's clearly made decisions on what's happening next with MIQ, and it's also made decisions around, from what you said before, about what's happening with school kids.
I didn't confirm that, Jason.
Well, I mean, we can assume, right? So
not necessarily.
Why not just make these calls when they're made, or after they? Why wait for the rest of the week?
Because I've not necessarily said that Cabinet has made decisions. Just, and maybe this is helpful. There's multiple places where we make COVID-19 decisions, and in part that's because, of course, you know, with the outbreak, particularly when we're making public health assessments around alert levels, we do need flexibility beyond Cabinet. So we will, in those circumstances, either use Cabinet on a weekly basis. We can give power to act to Cabinet committees who meet throughout the week, and we, throughout the entirety of COVID-19, for over a year now, have had COVID ministers who can meet on an ad hoc basis to consider papers out of cycle.
Confirm telling Kiwis when school kids can go back to school?
This week we will give greater clarity on those decisions. We will also discuss MIQ this week as well. I'm pretty sure I already gave an indication of that though. I'm going to finish with Derek and Joe. Last question.
So David Skegg also suggested that we needed to strengthen contact tracing capacity. He said last week, Dr. Bloomfield, that they would
focusing more on close contacts and less the casual because of the positivity rate there. But you also said that it can currently cover hundreds of cases a day. The previous recommendation was 1,000 a day. Do you think that? Do you agree with Professor Ski? Do we need more capacity there?
Not only agree, but that's why we have been building capacity right from the start of the outbreak and continue to, and continue to evolve the way we use the contact tracing system. And what we're working on now is, and we've got sort of new categories worked up, which are just being finalised around how we will use the contact tracing system depending on the vaccination status of both cases and contacts as well. And so we're adapting the system really to fit with the new alert level, the new protection framework.
What's the cases per day surge capacity that you want the ministry to be able to handle, or the national contact tracing system to be able to handle?
It's more an issue of where you focus the contact tracing capacity. So where you've got a case who is vaccinated, there are not very many exposure events, then the notification in that case may not require the sort of full interview that we have been doing to date. But we would be using that more thorough interview process for cases that are more complex, or where they may have they may be in large households or households that can't isolate safely. And so it's a matter of adapting the contact tracing system to this next phase really of the response.
So why is more wider use of other alternative testing, saliva and rapid antigen testing? Saliva is trying to be used more broadly. Where are we with rapid antigen testing?
So there's a pilot that's been rolled out with our MB colleagues amongst a number of businesses, and I know that there are also some businesses who have imported several 100,000 of the tests that they're quite keen to use. So we're encouraging and facilitating the use of rapid antigen testing. I should say that's again an area that we're watching closely what other countries are doing, because it's the timing and the way that rapid antigen testing is used is changing. We've seen Germany change its approach. Denmark has used rapid antigen testing, is now winding down the use of that. So we'll keep a close eye on what other countries are doing.
Joe.
Given it's been a few weeks now since it was first asked, I'm just wondering if you've given any further consideration to expediting the release of public health advice?
Of course, that is often managed. It would be great if you could ask the COVID-19 minister, because most of the papers come through the Minister for COVID-19 and through his team. So I'll remind myself before my next stand-up, but maybe you want to ask him on Wednesday as well.
He said last week that he was going to go away and talk to you about it. So did you have a conversation about it?
That has not been the thing that's been on the top of my mind of the conversations that I've had with him in recent times. Has not been bringing forward proactive release, because of course we do have the proactive release process, but I will try and remember next time amongst numerous other things. Okay, thank you everyone.
Thank you.